makes Greensboro a unique community for ASHHI funding is the experience that we've had around building partnerships toward creating healthy housing. We've always known that there was a need to address the housing issues, but the funding provided by the Kresge Foundation has provided an opportunity for multiple agencies to partner and work toward healthy housing together.
And so we've been able to change community opinion to where they recognize that the importance of healthy homes and how it benefits the whole community. Kids can go to school and learn better when they're in a good place to live. Hospital costs are lower. Property values are stable. So people are starting to realize that not only does this fit together, but it really benefits the whole community. We've created a lot of opportunities for people to engage and make a difference. Partnerships make all the difference in our work.
The Greensboro Housing Coalition has made a difference in advancing our efforts toward healthy housing by being extremely persistent in their efforts to educate the community, their efforts to draw in those who aren't normally participants in this type of initiative, and their efforts in bringing the people who are affected by unhealthy housing forward so that they can speak to the community.
This is an apartment complex in a floodplain, and every time there was a major flood, people were displaced, and everyone said the place just needed to be torn down. But it would be bought by another owner who would change the name, do no repairs, and until the next flood. We were appalled at the conditions and had about every major hazard that could kill somebody, maim them, that one can imagine. So we took a video camera out and interviewed the tenants, most of them with their faces off camera, about how bad it was. And we showed that to City Council when they were discussing the code policy. And then we staged a protest, and we went out with our little signs and our chants about how we wanted healthy homes. Well, the owner decided to sell, and because of the media attention that we had drawn to it, an investor in New York whose whole business is, he calls it repositioning distressed properties, noticed Ashley Creek Apartments and started investigating buying them, and immediately got in touch with me because I guess he wanted the Housing Coalition to be on his side instead of protesting against him. But we realized that he was going to go about this in a totally different way than the previous series of owners, and so we supported his purchase of the property, and he's investing about $2 million in so far in the renovations in addition to the purchase price, and he really appreciates what we have done. It's amazing that we can go from something so dangerous to such a happy ending.
Specific improvements that we've seen in our community as a result of the Housing Coalition receiving the Kresge funding include our City Council becoming really informed and aware and becoming real housing advocates and including housing issues in their campaigns over the last few years. One of the greatest achievements, I think, of the Housing Coalition in this effort is making city government, more specifically housing code enforcement, aware of how important it is for our housing inspectors to understand the healthy homes piece of the housing inspection and to get our inspectors encouraged and engaged in that initiative.
Well, we're really excited about our ASHHI partnership demonstration, and we chose that name carefully to emphasize that it's about partnership. But the hospital's accountability care organization is looking at best practices for for health care, not just do the next test and do the next prescription and the best medical treatment, but send people back to the same environment, and then they come back to the emergency room again. So when we approached them about working together on asthma, they were really excited about the opportunity to make a significant difference in childhood asthma. There's so much about housing conditions that impact asthma. When the hospital refers a child who has been admitted inpatient with asthma, we will do a detailed health questionnaire to see what has been the child's health history, and a scientific assessment of the risk in the home. We even have this particle counter to check the air quality to see the size of the mold particles in the air and the smoke particles. And then we will make those changes in the child's home, and then see whether that controls the asthma to the extent that the child doesn't have to go back to the emergency room.